early 19th century, doctors had no instruments to listen to the heart or lungs. The only way to check a patient's internal condition was by placing their ear directly on the patient's chest, a method known as direct auscultation. For many patients, especially women, this was deeply uncomfortable. At that time, social norms and moral codes were strict. It was considered improper for a male doctor to press his head against a woman's body. Yet without any alternative, most physicians had no choice. In 1816 in Paris, a young doctor named René Théophile Hyacinthe Laennec faced exactly this situation. He was asked to examine a young woman suffering from a heart problem. Feeling it would be indecent to place his ear on her chest, Laennec paused, searching for another way. Then he remembered something from childhood: how sound could travel through a solid object, like when children scratched one end of a stick and heard it at the other. He took a sheet of paper, rolled it into a tight tube, and placed one end against the patient's chest. He listened through the other end, and to his amazement, he could hear the heartbeat far more clearly than before. That simple experiment marked the birth of a revolution. Laennec went on to craft a wooden version of the paper tube, a hollow cylinder about 25 centimeters long. He called it the stethoscope, from the Greek word stethos, chest, and skopin, to observe. The invention transformed medicine. For the first time, doctors could listen to the inner workings of the body clearly, without violating a patient's personal boundaries. It was not only a leap in diagnostic accuracy, but also a triumph of professional ethics and human decency. In 1819, Laennec published his findings in a book titled De l'auscultation médiate, explaining his new method and describing the various sounds of the heart and lungs. It became the foundation of modern physical examination. Though simple, the stethoscope became a symbol of something greater, that science and empathy can coexist and that respect can lead to discovery. Laennec didn't just invent a medical tool, he preserved the dignity of patients and elevated the moral standard of medicine. Today, every time a doctor places a stethoscope on a patient's chest, they are continuing the legacy of a man who 2 centuries ago chose to be respectful, and in doing so changed the course of medical history.